Diabetes is a global epidemic and represents the major public health issue of the 21st century. In the U.S. alone, there are 30 million diabetics, 40% of whom are undiagnosed. The healthcare cost of diabetes in the U.S. in 2007 were $174 billion. The situation in the rest of the world is similar, with current estimates suggesting that there are 250 million diabetics now, and this is projected to increase to almost 400 million by the year 2025.
The problem in India is more acute with 50 million diabetics. In both the countries, effective diabetes care is hampered by lack of convenient and cost-effective technologies.
The most pressing problems are assessment of diabetes risk and the stage of complications. Diabetes complications include eye disease, kidney disease, nerve disease, as well as cardiovascular disease, which is the leading cause of death of diabetics. The principal unmet need in diabetes diagnostics is the existence of a convenient, cost-effective, and accurate method to determine diabetes risk. Diabetomics CRO and R&D operations combine robust clinical sample sets with sophisticated molecular technologies for biomarker discovery. Diabetomics' sophisticated genomic and proteomic research supports the development of novel biomarkers for diabetes risk assessment.
The completion of the Human Genome Project has created new possibilities for biomarker discovery. It is now feasible to carry out global analysis of gene and protein profiles to accurately and comprehensively assess disease risk and progression. This approach is superior to current glucose-based screening and diagnosis.
Diabetomics has identified novel biomarkers in multiple bodily fluids that are amenable to new non-invasive testing modalities.
A major hurdle in effective and convenient testing for diabetes and metabolic disease is the collection, transport, and rapid analysis of standard blood samples. Diabetomics has pioneered filter paper and saliva-based, easy-to-use testing technologies, providing greater access to comprehensive screening. Diabetomics' new state-of-the-art CLIA laboratories are equipped with the latest instrumentation and technologies for rapid testing and reporting.
The Diabetomics Clinical Lab offers 3 comprehensive test panels: the Advanced Diabetes Risk Profile, the Gestational Diabetes Profile, and the Personal Wellness Profile. The Advanced Diabetes Risk Profile is a panel of routine and state-of-the-art laboratory tests to identify prediabetes, diabetes, and diabetic complications. This panel of tests is ideal for anyone at risk for diabetes and for current diabetics that want to better monitor their disease progression. The Gestational Diabetes Profile is for expectant mothers within their 2nd trimester of pregnancy. This panel of tests is used to identify women who may be at risk for developing gestational diabetes later in pregnancy, before signs and symptoms occur. Early detection allows for important lifestyle and diet changes to be initiated sooner. 5 to 10% of women develop gestational diabetes during pregnancy. Gestational diabetes places the mother and baby at an increased risk for pregnancy complications such as preeclampsia, macrosomia, which is a large baby, and birth injury. It also places both the mother and baby at an increased risk of developing type 2 diabetes later. The Personalized Wellness Profile is a comprehensive panel of commonly ordered laboratory tests to evaluate heart health, metabolic status, liver health, and kidney health. This profile is ideal for identifying problem areas early and for individuals who want to track their general health changes over time. The Personalized Wellness Profile gives you the information you need to tailor an action plan specific to your health needs. Approximately 4 in 10 American adults have either prediabetes or diabetes, and of those, 40% do not know that they have the disease. Early detection of diabetes is important because damage to the body can occur 5 to 7 years before diagnosis.
As a type 1 diabetic, my biggest concern is diabetic complications. The Advanced Diabetes Risk Profile allows me the opportunity to detect complications early so that I can better manage my diabetes.
For the past 47 years, I have lived with diabetes, and I'm all too familiar with the many complications that can result. Early detection is the key. At Diabetomics, our mission is to create new products that identify diabetes at an early stage, thereby mitigating or eliminating the many terrible complications that can result.
Our non-invasive tests for comprehensive assessment of diabetes and its complications are easy to use, and they can be done at home or in medical office.
Diabetomics professionals bring more than 20 years of experience in clinical and R&D research to the problem of accurate assessment of diabetes risk. Diabetomics' mission is to be the industry leader in personalized diabetes risk assessment that will enable healthcare providers to tailor interventions and therapies for patients.